In the UK, we're one of the most inactive nations in the whole of Europe. 29% of the population are totally inactive. That means they do less than 30 minutes of physical activity a week. And this has a big effect on many conditions: diabetes, obesity, depression, dementia, arthritis, heart disease and stroke. The WHO actually says that this epidemic of inactivity and obesity is the fourth leading cause of death in the world. This is unprecedented in human history. We cannot continue to deliver healthcare as we're doing at present. At the moment, we deal with disease. We look at the end product, right at the end of the line. What we have to do is go to the source of the problem. I'm William Bird. I'm CEO of Intelligent Health and also a GP. I created Intelligent Health to transform the way we approach health and to tackle inactivity. Our main product is a game called Beat the Street. Beat the Street is a method of getting a whole population more active. We can actually engage up to 38% of the population. That's significantly more than the percentage of Pokemon Go, but it works similar. It's a game where we engage with schools, we engage with the GP practices, with the council, with community groups, with workplaces. We engage with every single facet of a community. We then give out smart cards to the schools and to some of the GP practices, and then we put up smart card readers on lampposts and in parks so that people have suddenly a map of all these beat boxes in the area where they live, and they touch their smart card onto that smart card receiver and get 10 points, and those points go to their team to try and reach a certain target. Initially, when people start, they think this is fantastic, we can get some prizes for our school, we've got the leaderboard and we'll hopefully come first. It's fun and there's a bit of competition, but very quickly it moves away from just points and prizes to these moments of experience. You'll get people now going out with their children on a bike ride to a park, which they've not done before, walking to work, walking to school, having that time with your family, with your children, community groups coming together who've not met before, and then exploring places they've not been to before. But behind all of that is a serious message of getting people more active, getting people connected together, getting people connected to the environment and the natural environment, and giving people that purpose. So we know that by getting all of those people geared up for the 7 weeks of this game, that they will actually change their behaviour. And that social norm has been instigated by this game of Beat the Street. It starts as a game, but it becomes a way of life. Beat the Street has expanded across the whole of the UK. It's in Europe. We've been to New York, we've been to Shanghai. 750,000 people have taken part so far in Beat the Street, and every single one of those people have had a story to tell. Every time someone taps their card onto a beat box, we create a timestamp data point, and those data points are in their millions across all the schemes. And they all tell a story. They can tell the walking speed of a diabetic patient improving. They can tell a group of people now collectively walking together, which they weren't doing before. And we're taking our knowledge and experience in engaging communities into delivering of social prescriptions so that patients don't just get tablets and medicines, but they actually get prescribed physical activity. Beat the Street is just the start of our ambition.